Hello, my name is Brent Reed, and I'm a member of the ATRIUM Cardiology Collaborative here at the University of Maryland. This is the first in a series of videos that we've put together on hypertension. Now in this video, we'll be defining hypertension and its levels of severity. So starting first with, what is hypertension? Well, simply put, hypertension is persistently elevated blood pressure, and you'll often hear it referred to as high blood pressure, or HBP. Now, temporary increases in blood pressure are a normal response to things like stress or physical exertion. But high blood pressure becomes a problem when it doesn't return to normal levels, as these elevated pressures can damage blood vessels and vital organs. Now, because most individuals do not have symptoms of high blood pressure until they have long-term complications, it's often known as the silent killer. So moving on to how blood pressure is described. Well, blood pressure is described in terms of the systolic blood pressure over the diastolic blood pressure. Now, the systolic blood pressure, or the top number, is the maximal pressure exerted by the blood, which occurs when the heart is contracting. Now, the diastolic blood pressure, or the bottom number, is the minimal pressure exerted by the blood, which occurs when the heart is relaxing. And the difference between these two is what's known as the pulse pressure, and this is what you feel when you check someone's pulse on their wrist or neck. Now, blood pressure is measured in units known as millimeters of mercury. Blood pressure is staged according to its severity because the risk of complications increases with varying blood pressure levels. Now, because blood pressure can vary significantly from moment to moment, it's important that the average of two readings be taken rather than basing the diagnosis on a single isolated reading. Now, it's important that the measurement technique also be correct, so we've dedicated an entire video to that topic alone. Now, normal blood pressure is less than 120 over less than 80 millimeters of mercury. A systolic blood pressure of 120 millimeters of mercury to 129 millimeters of mercury over less than 80 is considered elevated blood pressure. Now, this classification refers to individuals who are at risk for developing hypertension in the future, but for whom lifestyle modifications may be sufficient for bringing blood pressure back under control. Now, a diagnosis of hypertension is made when the average of two or more readings exceeds 130 over 80 millimeters of mercury. Now, hypertension can also be defined as anyone that's taking medication to lower their blood pressure, even if their pressure on medication is below this threshold. Now, hypertension can be further divided according to severity into stage 1 and stage 2 hypertension. Stage 1 hypertension refers to those blood pressures of 130 to 139 over 80 to 89 millimeters of mercury, whereas stage 2 hypertension refers to those blood pressures exceeding 140 over 90 millimeters of mercury. Now, the last category of hypertension is what's known as hypertensive crisis. Now, although the definitions vary, a hypertensive crisis generally occurs when blood pressures exceed 180 over 120 millimeters of mercury. Now, hypertensive crises can be further divided into hypertensive urgency and emergency. A hypertensive emergency is differentiated from urgency by the presence of end organ damage, such as elevated blood pressure that results in a stroke or a myocardial infarction. Now, staging of hypertension is also important because it determines the aggressiveness of lifestyle interventions and pharmacologic therapy. And these are the subject of other videos in the series, so we encourage you to stick around and check them out. Thanks for stopping by.